During my PD years, I worked in a cardiothoracic surgery lab on campus, doing basic / translational science, working a lot with animal models. Starting off my first year, I was doing a lot of heart failure specific work, and what we were doing was kind of fabricating these what we call vascular organoids, which are using endothelial progenitor cells and smooth muscle cells, kind of like the building blocks of blood vessels, and then transplanting them onto hearts that have undergone heart attacks and trying to combat ischemic heart failure progression. And during that first year, it was a lot of pig surgery. So that's mostly what I did my first year. And then kind of in the background, going into my second year, which what I'm doing now is working a lot with heart transplant models. And so what we're doing is working with a organ preservation solution, a novel organ preservation solution, for which we're trying to extend that time that we can put any organ really, but we're starting with the heart on ice to allow to expand the access to transplantable organs. So I've always been interested in cardiac surgery since medical school. So it's I kind of been a little bit lucky in knowing that that's kind of where I wanted to end up. So once I kind of was looking for PD stuff, I just kind of emailed around the cardiac surgery department, a separate department here. So it was a little bit of a uphill battle going out of the department, but I was very lucky. I was met with kind of like well reception, and was able to find a lab to work in. And I didn't have a lot of experience before with basic science, translational science. In fact, I had zero experience before. So I was very lucky that my mentor was willing to be patient while I got up to speed and kind of learned about research. And he taught me a lot, and my co-lab members taught me a lot. And so that's really, it was actually just as simple as an email, believe it or not. I was very lucky. I felt very, very lucky that that's how it worked out for me. So I've been lucky enough to receive the general surgery PD grant both years. And then also actually, I had applied both years and was awarded both years the Stanford Children's Transplant Center of Excellence Award. So that's kind of a lesser known grant opportunity, I think. And basically they award grants that have to do, or award projects that have to do with transplant, tissue engineering. And even though the first year I was more of a tissue engineering project, and this year more of a transplant project, so it happened to, my projects happened to line up very well with that, and I was awarded that both years as well. Nice. The only thing it's kind of influenced is actually I've taken more of an interest in transplant. I did not consider that as a possibility of my future career, but I think I would like to have some sort of transplant element to my practice. I have been very grateful to the department for supporting my endeavors outside of general surgery. The fact that I was funded for doing something that really does not have a lot to do with the department was incredible, and I'm very grateful that the department has fostered my scientific development in that way. And I just think that this place is great. I love the clinical work. I love the research work. I'm excited to go back to the hospital. But if I was told, you have to take another year in the lab, I would be excited to do another year in the lab. And I'm just really grateful, and I love it here.